Osteopathic medicine puts a lot of emphasis on the holistic nature of treating a patient. You know, looking not only at the disease that they have, but trying to get them back into the state of health that they could be. Looking at a patient and realizing that the body has a marvelous way of healing itself a lot of the time, and what, you know, to look at the patient and see what we can do to help them get back to that state of health.
Tell me why you are interested in going on and pursuing advanced education in oncology.
A number of reasons. Academically, because I think it'll always challenge me on a patient care, physician-patient relationship type. I want to be that person that helps patients through difficult times. And then just personally, in high school I babysat for 2 kids whose mom had leukemia, and there were a couple days where the kids were gone and I was her caregiver. And as a high school girl, that was kind of an intense experience, but one that taught me a lot. She was an excellent mom. And I wanted to be with those kind of patients. When I was in medical school, my dad was actually diagnosed with pancreatic cancer. He passed away when I was an intern at Grandview. It's an awful disease, all cancer is, but I think realizing that I have that passion within me to help those people, and I have that experience, I guess, in seeing patients through good things and seeing them through the end. So,
What are your options right now? What do you plan to do?
I went to an osteopathic medical school. I chose very specifically an osteopathic residency, and I would like to train in an osteopathic institution for my fellowship as well. Grandview is known as a leading osteopathic teaching hospital, and that means a lot of people want to train there, and that means that there's not necessarily enough money to go around for everyone to train. So for me to stay there, I mean, my heart's there, I want to stay there, and the actual position and the fellowship exists, but we need funding in order to make that a dependable fellowship for years to come.
It costs us a little over $100,000 per year per trainee. So for a 3-year training program like hematology, oncology, it would cost us about $300,000.
Well, on behalf of Mr. Mills, Dr. King, Dr. Gordon, and myself, we would like to offer you the Marcy Mills first fellowship position, if you're willing to accept.
This is a big setup. Thank you. I'd absolutely accept with great humility. Absolutely.
You did very well.
All right, where are the tissues?
All right.
I feel like I was just punked.
Were you starting to catch on there?
No. I thought I was still going to go trick or treating.